So the other day I got to talk with Dr. Ackerman as he wrapped up a special Women's Health series highlighting important information for women in their 50s. Take a look. Finishing up his special Women's Health series, Dr. Scot Ackerman is one of the First Coast leading oncologists, and he's focusing on women in their 50s. Welcome, Dr. Ackerman.
Thank
it's
you,
always
Nick.
good to see you,
Thank
as
you.
always. So what are the changes that are happening with women in their 50s? What should they be looking for?
Well, last week we talked about women in their 40s, and the week before that we talked about women in their 30s. And so these same things are happening more, they're progressing, and there's more issues that just build on the foundation that we talked about over the past 2 weeks. And so we see that the risk of heart disease increases. So now, once you're in your 50s, the chance of you developing heart disease is nearly 40%. You continue to have bone loss. We talked last week about calcium and calcium supplements. 20% of women in their 50s have osteoporosis, and osteoporosis is severe bone loss, but half the women have osteopenia. And osteopenia is defined as a moderate amount of bone loss. It's a pre-osteoporosis syndrome. Wow. So again, we're going to talk a little bit about calcium and those sort of supplements. Also in your 50s, when women in their 50s, their immune system starts to decline. There's a gland just behind your chest bone called your thymus, and that thymus gland atrophies a bit, and so your immune system starts breaking down a little bit. And women and men in the 50s start having some memory loss. Our brain isn't as sharp as it used to be. We're not doing as much thinking and brain exercises, and so our brain function starts deteriorating a little bit. We get a little bit more forgetful about things. Also we see a diminishment of thyroid hormone. Many women need to be put on some sort of thyroid supplements to keep the thyroid hormones proper, and estrogen levels also continue to decline as women are going to the final stages of menopause. Last year we talked about this perimenopausal period that women start to get into in the end of their 40s, and in the 50s estrogen levels start going down and women are in frank menopause.
Really a lot to think about, a lot to make sure that you keep up on and keep track of and everything. Is there an average age that you're finding that women are hitting menopause?
Well, the average age for women to go into menopause is 51, but there's a lot of variability. So menopause is defined as when a woman doesn't have a menstrual cycle for 12 consecutive months. Afterwards, you become what we call postmenopausal. But this perimenopausal period can be for a couple years, where a woman may have a cycle 1 month and then 3 or 4 months later have a cycle again. But once a woman goes through menopause completely, then a lot of the symptoms associated with the perimenopausal period, symptoms such as hot flashes and irritability and uncomfortableness, these start to decline, and a woman goes into her perimenopausal state.
Is there anything in particular that women should be doing differently once they hit their 50s, certain things that they should be looking out for and focused more on?
Well, we've talked over the past few weeks about calcium and vitamin D. Again, as women get older, the bone loss can be a very serious thing. I just mentioned that half the women have some bone loss and 20% have a severe amount of bone loss. And you can combat that a bit by increasing your calcium intake and adding vitamin D as well. I mentioned that even in your 30s to start taking calcium. But now you want to increase your calcium amount to about 1,200 milligrams per day, and your vitamin D to about 1,000 international units a day. Also, you want to start taking B12, which you'll find in fish and meats. I mentioned a minute ago about heart disease. Well, if you cut back on your salt, you reduce your risk of hypertension, and also help combat heart disease. So when I talk to patients about salt, I generally recommend that they limit their salt intake to 1.5 grams a day, or 1,500 milligrams a day. Also, as you get in your 50s, with these estrogen levels going down, women start to gain weight and having their weight distribution a little bit different. So again, continue with exercise, weight control. Weight control will lower your risk of death. Weight control also reduces the risk, believe it or not, for dementia also. So continue with the exercise program. And exercise program will also help build those bones. The hormones that are released during the act of exercising allows calcium to be incorporated into the bones and makes the bones stronger.
It just makes you feel better. Anytime you work out, even if you're going for a nice walk or whatever, you just feel refreshed. You feel better overall. Now, last week you talked about women in their 40s, and there were certain screenings that they should be doing on a regular basis. Should they continue these screenings after 50?
I recommend to my patients that they should continue their cancer screenings as long as they're in good health. If you become very ill and you and there's a life expectancy of less than 5 years, you can stop doing screenings, but still do cancer screenings. So we're talking about breast self-examination, skin checks, look for changes in moles, see your physician or your gynecologist for a pelvic examination, which should include a pap smear and a HPV test, which should be really every 5 years until you're 65. Some societies, like the American Gynecological Society, recommends it a little bit more frequently than that. So speak to your physician about how often you should have a pelvic examination. It also depends on what he or she finds and what symptoms you're having. All those things come into play. Also mammography. We know that mammography saves lives even for women in their late 80s and 90s. So annual mammogram, I recommend annually after the age of 40. And certainly through your 50s. Also monitor your blood pressure. I was at the supermarket the other day, and it's for free. You can go right there and put your arm in the machine.
and check the whole thing.
It's fairly accurate, and that's always reassuring to see your blood pressure was good. So I was there with my daughter, and we both did our little blood pressures. It's good to see that. And
so they keep those machines up.
Yeah, they do.
It's pretty close to accurate. Yeah, you can't beat that.
Also, get your cholesterol checked and your sugar, your blood glucose. Right.
Very cool. Anything that they should add? Any certain things?
Well, now that you're in the 50s, what you need to add once you hit the 50s is 2 things.
Okay.
Once you hit 50, we recommend colonoscopy. Should be done at the age of 50, a full examination of the colon.
Okay.
Colonoscopy does 2 things. One, it diagnoses colon cancers early, which saves lives, but more importantly, it could prevent colon cancer. You may ask, how does it prevent colon cancer? Well, it prevents colon cancer because if the endoscopist sees a polyp, and that's removed, and that's a benign polyp. Had that been left in there, that benign polyp would probably progress and become a frank colon cancer. So colonoscopy not only diagnoses cancer early, but prevents colon cancer. Colonoscopy at age 50, if it's clean, every 10 years. If there's some abnormality, the endoscopist may recommend doing it a little bit more frequently than that, or if you have family history of colon cancer more frequently. And also a bone density study. At age 50, get a good baseline bone density. We talked about the calcium.
Yep.
You can get that measured. Typically, women get it done the same time as a mammogram. Most facilities that offer mammography offer bone density too at the same time.
Great. Thank you so much. Always good information. I'm going to take some of that info for myself as well. I think
there's a lot of good information there for yourself as well. The whole colonoscopy thing applies to men and women equally.
Right.
And calcium loss too.
Yeah. Very cool. All right. Thank you, Dr. Ackerman, for the information and for sponsoring this segment. If you have any questions regarding this topic or any other health questions, just visit Dr. Ackerman's Facebook page, facebook.com/First Coast Oncology.